Hello, everyone, and welcome to another live Q&A with some of our amazing Winona doctors. You might recognize these two. There's some familiar faces right around here at Winona, which we love. But if you've never been to a live Q&A before, we're so glad you're here. We're so glad to jump into in just a minute answering some of your questions. We're going to get to as many as we can tonight. If you haven't been here before, or if you have been here, just a reminder, go ahead and start dropping your questions in the chat over on the right-hand corner of your screen. It's usually a good idea to get those in as soon as you can, because sometimes it gets a little crazy in there, and we want to be able to get to your question as soon as possible. But again, we're so glad you're here. And I'm going to go ahead and let our amazing doctors introduce themselves, and then we'll get started. But Dr. Green, I will hand the mic over to you and let you start us off with that.
Hi, my name is Mike Green. I am a board-certified OBGYN. I'm the Chief Medical Officer of Winona. And this has been my passion when we launched. Actually, that's the cool thing. So this is our April is our 4-year Winona anniversary since we launched. But I've been involved with this thing since a lot longer than that, because there was some planning involved to get this thing off the ground. This has just been an amazing journey. It's just so great to be able to take care of so many women that need hormone replacement therapy. They need help with the menopause transition, and it's just been a pleasure taking care of everyone. So we're super excited. One of the founding principles at Winona has been patient education. We think it's really important for people to understand what's going on with their body, why they're getting the treatments they're getting, and really have an open dialogue that way. And so we spend a lot of our time doing that. We do the live Q&As. We have a ton of information on our website, and we like to spend time with our patients through the messaging, through the patient portal, the messaging platform, answering questions, making sure people understand and are well educated. So that's what this is all about. There's no stupid questions. Maybe it'll be the one that we laugh about later. I'm just kidding. But please ask your questions, basic to complex. And we might scratch our head and go, "Why? I don't know. No one's ever asked me that before." So, and we will do our best to admit when we don't know something, but we'll try and do the best we can. And so, Kat, why don't you say hi?
Sure. It's always hard to follow you, Mike, though. My name is Dr. Kat Brown. I'm also a board-certified OBGYN, and I joined Winona about a year after, not quite a year, I guess it was like 12 months after you guys started. And so I'm the medical director at Winona. I also am one of the doctors caring for patients in Pennsylvania and Florida and Michigan and Hawaii. But really now my role as medical director is helping to curate our medical journal content, really trying to get the word out there. I do a lot of podcast interviews representing our company, but also just trying to get our message out to as many women who need it. And we want women to learn as much as they can about their own bodies, about this transition, and help their friends and share the knowledge, because really knowledge is power, and we want you to feel empowered, and you should know as much as you can about your own body and what's happening. And even if you're on the younger side of the spectrum going through it, before you hit perimenopause, I think it's so helpful, for women to learn as much as they can. And so, like Mike said, that's one of our founding principles is just education, and we think that it's really important that women learn as much as they can. So yeah, if you have questions, please feel free to put them in the chat. Looks like some people are typing away. I keep seeing typing messages, which is good. But just a little bit more about me while we get some more questions in there. I'm also a mom of 3, and my kids are on spring break right now, and they're chomping at the bit because we're going on a little mini trip this weekend. But so they're chomping at the bit for me to get in the car and go out with them. But and when I'm not doctoring and taking care of patients here, I'm in the garden, I'm traveling with them when I can, and trying to balance it all. So I know what you guys are going through, what women are going through out there. So do we have some questions to start off with, Maddie? What do you think?
We do. I think we have some great questions to start off with. And thank you both so much for those introductions. I think it's always great to get to know you all, I think, as people, as well as what being a doctor too. I think that's so great. But tonight, our first question is from Rebecca. And Rebecca is wondering, would I be a good candidate with my history of migraines?
Yeah, so unlike birth control pills, migraines are not a contraindication to taking HRT. A lot of women maybe have been told not to take female hormones, especially if they have what's called an aura with their migraines. And for those of you that are not migraine sufferers, you may not know what this means, but basically an aura is like an anticipatory symptom that you can get that kind of tells you that your migraine is coming on. So someone might get a weird taste in their mouth, or they might see a weird light in their vision, get some kind of anticipatory symptom that they know a migraine's coming. And when it comes to birth control pills, which are much higher dose compared to hormone replacement, when you have a history of migraine with aura, it can mean that you're at higher risk for something like a stroke or a mini stroke. But really that risk does not extrapolate to hormone replacement therapy. And the main difference is that birth control pills are synthetic hormones that we're giving you in high enough doses to suppress your body's own natural system. Whereas when we give you hormone therapy, we're giving you back the hormones that your body is creating on its own, especially ours are bioidentical, meaning that they're the same as what your body creates naturally. And we're just giving you back enough to kind of help those symptoms and help your body function as best as it can. So the risk is not the same. And so women that have suffered from migraines and maybe weren't able to take birth control in the past can actually take HRT safely. So long answer to a short question.
I want to jump in there and just say, I put my money where my mouth is. My wife has migraines with aura, and she is on Winona HRT. And I love my wife, so it's not like I'm hoping she strokes out. So I obviously think it's safe enough to use in the dearest person in my life. And so, if it's safe enough for my wife, then it's safe enough for you. I wouldn't do anything to you that I wouldn't do to my own family.
Yes.
So, and that is a common concern or question people have.
Thank you both for those answers. And our next question is from Marie. And there isn't any necessarily extra information with this one. So she's wondering, is it normal for facial skin to peel? I'm not exactly sure if that's referring to the DHEA or the creams or our face cream, but maybe I'll let you all take that one away.
Well, I mean, in the natural aging process, and especially in menopause, the quality and the texture of the skin changes overall. And so many women will notice that their skin becomes more dry. It's harder to keep it moisturized. We lose the suppleness and the elasticity of our skin. But I'm tending to wonder, this question might be related to our face cream, because that's something that we hear very commonly from patients. So if you are not aware, or if you're new to Winona, we have a combination face cream that's like an anti-aging face cream that has a combination of estriol and tretinoin. Tretinoin you may have heard before as Retin A or other forms like Differin, a lot of different names and brand names out there. It's been used for ages for acne treatment and for other dermatological treatments because it causes cellular turnover. And that's how it helps with the aging process, is that it helps take that old, rough, old skin cells off and show that newer, fresher skin from underneath. So when you're using a face cream that does that, it can be very normal to feel like you have peeling of the skin, to get over drying of the skin. And it's really important that you not overuse those types of medications, especially as you're first starting them, because you can be more prone to the over drying. So we usually have patients kind of start it slow, using it 1 or 2 nights a week, moisturizing intensely in between, and then gradually they can increase their frequency of using a face cream that has these components in it.
The cool thing about the face cream, because we have the estriol, you can get away with a lot lower dose of the tretinoin. And so that's kind of a surprise for people that have been on tretinoin, is that, our dose is smaller than what some people are used to using, but it still works really well. So it really minimizes the side effects, because the estriol, they really work synergistically. So you can get away with a lower dose, but still get even more benefit. So it's kind of a nice mixture. And as far as I know, we're the only company that has the two together in the same compounded cream. There are a lot of companies that sell them individually, but when they're compounded together, they really work, much better than either one alone.
And we have a question next from Jen. And Jen is wondering, how long before we really feel the effects of the bioidentical HRT cream? And she also is asking, how do you decide how strong the dose is for each person without blood work, or is it one dose across the board? So I can reread that second question if we need to come back to that.
You already know. We were waiting for the second question.
We always get the question. So we both, Mike and I both anticipate the question. Like, when's the question on labs coming? But to answer the beginning part of that question, it really depends on a woman and her constellation of symptoms as to how quickly her body may adapt and start to respond to the cream, or any form of HRT, really. So early on, many women will start to notice some improvement in their vasomotor symptoms, meaning that, hot flashes, night sweats, some of those symptoms will have some relief early on. But really, to get the maximal effect, it comes later as your body gets acclimated to the medicine and we get therapeutic levels of the hormones in your system. Now, when it comes to the labs, so really female hormones do not behave like any other lab that you would get from your doctor. They fluctuate so much. They can be, change with the time of day that you have the labs done, whether you've had a meal, not had a meal. And unless we had the ability to check your labs multiple times a day, every day of the month, to really see what it's doing over time, it really wouldn't give us that information. And that's why labs are not really helpful. It's an undue burden to consider, a woman to get blood testing done that frequently and that often. And also your insurance wouldn't pay the labs to do that. But so that's why it's best to treat based on symptoms. So we can take a look at the symptoms that you report and know what hormones would help you. And actually, Dr. Green came up with a nice algorithm that helps us to come up with our best guess for your starting dose. But like anything, like trying on clothes and trying on anything else, sometimes it's a bit of trial and error. And so we start you on our best guess for that first dose, but then we see how you respond. And sometimes we get lucky, and a lot of patients don't need an adjustment and they don't need a dosage change, but a lot of women might need a little bit of tweaking to get their symptoms even better. So that's how we would, respond to that.
And the way the algorithm is designed, it's purposely just slightly under doses. So the idea is we want to nail it, but I'd much rather not quite get all your symptoms under control than give you side effects. So most of the time, if we have to adjust, we kind of goose it up a little bit rather than having to dial it down. Because I think it's the right approach, kind of start slow, work our way up, find the right dose for you without, causing you misery. That's the idea. So that's kind of how it's designed. But, it's surprising how many times the algorithm actually nails it and, we get you on the right dose. And the other thing is sometimes people will be on a great dose for a year or two and then their bodies change some more, and all of a sudden we need to change the dose a little bit. So that's not unusual as well.
Absolutely. And we have a question next from Zulmira, and she's wondering, what should I expect to feel the first few weeks? And then she says, and that's with the HRT, the DHEA, and then also the vaginal cream.
So like I mentioned a little earlier, every woman responds a little differently. Initially, you should expect to see some benefits within the first few weeks to start, but you can also anticipate that your body may respond a little negatively to the medication at first. Not so much the vaginal estrogen cream, but from the systemic HRT. You're adding in something that your body's never done before. And when it comes to women in our bodies, anytime there's a big fluctuation in hormone levels, whether we're giving you a medication or your body is going through its own transitions, you can expect to have some side effects, as your body does that. And every woman's a little bit different with how she'll respond. But I usually encourage patients to really, really take the whole, holistic approach when they're starting their medication. Really try to optimize your sleep. Really try to make sure you're drinking plenty of water, because our bodies function optimally when we are well hydrated, and your body's going to metabolize the medication better and incorporate it better, I think, if you're well hydrated compared to dehydrated. And really focus on your nutrition those first few weeks. And so rather than looking at how your body's responding to the medication minute by minute, I just want you to focus on the whole picture and do those other things, as you're starting to take the medication. The big thing is just to remember to take it every day. That's the hardest thing if you're not used to taking medication every day. And then really just focus on those other aspects of your total wellness before you really start, scrutinizing the medication and knowing what to expect. I don't know if you want to add to that, Mike.
As you said, the body sometimes doesn't like all of a sudden getting a change. Body doesn't like change. And so it's not unusual to have some side effects in the first few weeks. It takes about 3 weeks, 4 weeks, somewhere in there to get a nice steady drug level if you're taking it every day like you're supposed to. So those first 3 weeks, sometimes we've got patients that say, oh my gosh, I feel like $1 million right away, and that's great. But we have other people that have some side effects at first, and they tend to get better with time. And usually by the 3-4 week mark, people are starting to feel a lot better, and they're starting to experience some of the benefits. The vaginal cream is usually a winner pretty early on, and that's the nice thing about it. You do have to kind of load it, so we have you use it every night for a couple of weeks, which is a little annoying. And then you'll start spacing it out to every other day, and then maybe 2-3 times a week. And eventually you can typically use it less and less. But it does tend to give that you tend to get benefits pretty quickly. The systemic sometimes takes longer, and you kind of got to hang in there. Really, the 3-month mark is kind of where we have a pretty good idea of what that dose is going to do for you.
And we have another question from a different Jen. But this other Jen is wondering, she says, hello, thank you so much for this. She says, I'm 47, I'm in perimenopause. She says, what really are normal hormone levels? She says, all my levels are at the low end, and my GYN doesn't think that estrogen therapy is needed prior to menopause. And is DHEA safe to take in addition to 4 milligrams of testosterone cream?
You really shouldn't take DHEA if you're already taking testosterone. Let's start with that.
I'm kind of laughing that your OBGYN doesn't think that you need hormones, and then he's giving you a bunch of testosterone. That's kind of backwards. But
right.
There's a strange concept out there. I mean, I don't understand why OBGYNs do this. And the idea is that if we give somebody enough testosterone, their body's going to break that down into estrogen, which is true, but it's kind of a backwards way of doing it.
Yes.
You need a little touch of testosterone. That can be really helpful for women. Testosterone in women is tricky because it has what's called a narrow therapeutic window. In other words, the amount you need to help and the amount you need to have terrible side effects is not that different. And so it can be a really tricky drug. And that's where DHEA is really nice, because in the doses we use, it's not going to push you above normal female levels. So it's not going to give you the really bad testosterone side effects that we sometimes see. So I just find it interesting that on the one hand, they're telling you, oh, your hormones are fine, and then they're whacking you with a bunch of testosterone. It's kind of an interesting approach, honestly, especially from an OBGYN. But yes, if you're on testosterone, you shouldn't be taking DHEA. It's redundant, and it's really not the way you want to do it. But again, these blood tests don't tell us anything. They're basically like not doing the test at all. And in fact, it's worse than that, because now you've got numbers that you think are accurate and they're not. And then you make decisions based on bad information, which tends to lead to bad decisions. And so if you're having symptoms that are classic symptoms of the menopause transition, I don't care what your blood tests tell me, your body is already telling me that you need some estrogen and, maybe some other hormones to go with that. But certainly estrogen is really the key player here. Testosterone is helpful as an adjunct, however you say that word. But for women, that's not really the primary hormone that you need. A little bit can go a long way, but it's just kind of an interesting treatment approach, in my opinion.
Yeah, I've heard that from a lot of patients that, that they were on that. And I think that, a lot of women receiving pellets, kind of they have that theory to do it that way. A lot of testosterone up front. But when you read more and more and you do the research into what hormones really benefit a woman's body, estrogen is the powerhouse, So waiting for something to get converted is not a direct way to help.
The thing with testosterone is, you can get a little bit of euphoria from testosterone. You can get this this surge of testosterone, and it gives you this sort of euphoria, this testosterone high. But there's a dark side to it. And so someone gets a big dose of testosterone as a pellet or a cream or a shot, and at first they feel, oh my God, this is the greatest thing ever. And then a few months into it, all of a sudden the side effects start showing up. And so it's a bit of a treacherous drug, in my opinion. It doesn't mean there's no place for it. There absolutely is a place for it, but usually in combination with estrogen at least, and then progesterone if you still have a uterus. So I think you may, depending on your symptoms, maybe a great candidate for some estrogen. And maybe the testosterone is beneficial as well, but I certainly would not also add DHEA.
And we have a question next from Carrie. And Carrie is wondering, are headaches normal when starting HRT, the 50-50 cream, and DHEA? She says specifically not long after application or with taking it orally with the DHEA.
So headaches can be a common symptom for a lot of women to experience with just hormonal fluctuations, period. And I'll tell you personally, that was one of the biggest symptoms that I had in perimenopause before I started HRT, was just frequent headaches. And I was never someone who got headaches prior in my early life at all. It was definitely something related to hormones. A lot of women are prone to headaches with their menstrual cycle as well. And so when you're first starting HRT, because there's a big fluctuation in the hormone levels in your body as we're adding medication in, that can also trigger headaches for some patients. So going back to the same thing, hydrate, focus on nutrition, optimize your sleep, because we really can't function as our best selves, and our brains can't function well if we don't do those things either. So it's another reason to do those things for your total wellness as well.
And our next question is from Melissa. And Melissa says, I was on a script for HRT, the patch, and she says, I recently switched to the 50-50 cream. And she says, since then, I've had some night sweats that have started. She says, do I need to wait for an adjustment, or do I need a new prescription, or just more time?
Depends how long you've been on the cream. So the cream takes a little while to really get blood levels up, a good 3 weeks. Sometimes if somebody's transitioning from a pill or a patch to a cream, I'll have them use the pill or the patch for a couple of weeks while they're using the cream, just to kind of get through that transition. So it's not unusual to have kind of a little gap. If you stop the patch, start the cream, it can take a few weeks for that cream to kick in. And in the meantime, the patch is no longer working, and you get this little kind of gap in treatment, and you can get some backsliding of symptoms. And that, if the cream is an appropriate dose, it should go away, but it may take a month, may take a few weeks to a month, may take a little bit longer. Or it may be that you need a higher dose of the cream depending on how long you've been using it.
And our next question is from Amber. And Amber says, is it normal to feel like you no longer have the ability to think? She says, I feel like I can't grasp simple things, and I'm really suffering at work. I get anxiety so easy. And when I feel pressure to understand conversations that I just can't grasp, I feel really horrible.
I think she's describing the classic brain fog that a lot of women experience. And it's so very common of a symptom that many women experience during this time. And typically estrogen helps when we start adding in hormone therapy. So it takes some time, to get the really beneficial effects, but definitely I think it would help the brain fog for sure.
And our next question is from Laura. And Laura says, is it true that you have to stop HRT after a few years due to it possibly causing cancer?
No. So years ago when I was a resident learning how to be an OB/GYN physician, we had just seen the backlash of the WHI study, and we were taught the lowest dose for the shortest duration possible. Like, just get women over the hump and then take them off as soon as possible. And now the data is showing us that actually, no, it's safe to continue. There are so many beneficial health effects from hormones that women take. And really, when you think about any medication, there's no medication without risk. But the absolute risk of you getting a cancer from this medication is very low. We get exposed to so many other things in our lives. You probably get exposed to more radiation going through a drive-through window or using your cell phone regularly that could be causing some ill effects in your body than a single medication would be to causing cancer. And the data shows us now too that, taking estrogen alone is actually, beneficial and actually doesn't have a risk of causing breast cancer. It's typically the combination of estrogen and progesterone, which is necessary for women who still have their uterus. But it's that combination that can slightly increase the risk. But when we compare it, to everything out there that could kill you, and Dr. Green likes to say, you got to die of something someday, right?
That's right. At least once.
Right. But I think comparatively for women, not very many women are aware that they are much more likely to die of a heart attack in this day and age in the United States than they are to die of breast cancer. We're all very afraid of these GYN cancers and breast cancer and everything out there in the news, but you're much more likely to have an event with your heart. And beneficial effects of HRT, it actually helps your cardiovascular health overall, especially when started at the right time. And so that's something comparatively, you're more likely to die of a heart attack than you are of breast cancer, if you think about it, in the big scheme of life.
Now, if you look at the statistics, women that are appropriate candidates, of course, that take HRT are more likely to live longer, healthier lives than women that don't. And so, I mean, that's really what it's all about, right? And that's where this comes in. Everyone's got to die of something at least once. So, I mean, eventually something's going to get you. But the idea is to put that off as long as you can, as long as you're living a happy, healthy, productive life, right? And so if you take HRT, you're more likely to live a longer, healthier life than if you don't. So now you can kind of get into that's the woods, but you can kind of get into the trees and the little needles. Yeah, but I'm going to end up maybe, I have a higher risk of ending up with this. Yeah, but you would have been, the reason is because you would have died of a heart attack before you ever got that, fill in the blank. So now you're going to live an extra 10 or 15 years and eventually something's going to pick you off. But, much better to avoid the big common thing, which is, cardiovascular disease. So it's really a misconception. And we always like to talk about this a long time, because at least I know for me, it bugs me that there's this misinformation out there, and people are afraid of getting treatment that's really beneficial for them. It's kind of unfortunate.
Very much so.
And our next question comes from Dana. And Dana's wondering, she says, why do I still get the exhaustion the week I would normally get my period, even though I haven't had one in 3+ years? She says, I get so tired, I can hardly stay awake during the day. She says, I've only been using the Winona cream for 2 months. But she says, when I talk to one of my doctors about it, he tells me to talk to my gyno, and my gyno tells me to talk to my other gyno. She says, will this ever stop on this end?
Yeah, so even though you're not having cycles, your ovaries may still be producing their own hormone, depending on where you are, how old you are, in this process. And so if you're still getting, premenstrual or menstrual symptoms, even though you're not actually having bleeding, it could be related to your, fluctuations in your body's own hormone levels. If, as you continue to take the medication, typically that should help to level that off. And if it hasn't, or if you still notice a constellation of symptoms that are still bothersome, we might need to adjust your dose.
Yeah, there's this idea that people have that's not correct. And that is, we define menopause as 12 months without a menstrual period. And so people have to say, okay, so people are like, oh, I got 30 days left and I'll be in menopause. Like, well, yeah, but that's just an arbitrary definition, because we have to define it some way. But it's not like, okay, 12 months without a period, now all of a sudden your ovaries shut down and stop working. That's just not the way it is. And they're still fluctuating, but there's a threshold that needs to be met for the amount of hormones they're making, the fluctuation making to actually have bleeding, which is what we call a menstrual period. So they're still fluctuating, and so that's probably what you're experiencing. And the HRT, because that keeps kind of a nice constant level, these fluctuations become less significant as you have a baseline level. And so as you continue on the HRT, I think that's going to be less and less.
Absolutely. And our next question is from Alicia on Facebook. And Alicia is wondering, she says, I started the 50-50 cream and the DHEA about 2 weeks ago. She says, is it common to experience fatigue mid-afternoon? She says, I use the cream at night and then DHEA in the morning.
Yeah, this could be your body responding to the change in hormone levels, but you also may need to experiment with what time of day works for your body the best. So if you're noticing that you're getting tired the same time every afternoon, then maybe you need to tweak when you're taking each medication. So a lot of women will take the DHEA in the morning, but some women actually do better taking the DHEA at night. So you might need to experiment and see how you respond best.
Some women find the DHEA gives them a little boost, so you might try taking it at lunchtime or an hour or two before you notice that fatigue, and you may get some added benefit out of that as well. It's fine to experiment with time of day. You don't really want to experiment on your own with dose, but it's fine to experiment with the time of day you take it. It's like there are some things that are okay to play with and some things not so much. But time of day is totally okay to try and see what works best for you, because everybody's different. Like for most people, progesterone makes them sleepy, but there's a certain percentage of people it does the opposite, and they're like boing, and they're wide awake like on caffeine. And those people who take it in the morning, and they're even rarer, but it happens where it just gives them terrible, like vivid dreams, and take it in the morning and it solves that problem. So you kind of got to see what your body does, and then listen to your body. Your body is really sensitive assay. And so you want to try and be in tune with your body, listen to your body. I always say, follow your gut. It usually is going to lead you correctly.
Mm-hmm. And we have a question next from Grace. And Grace is saying, I just started this investigation into myself, and she's wondering if I'm experiencing perimenopause or ADHD or both. She says, how can I know the difference between these?
Well, there's various quizzes online that you can do for ADHD, but if you're not sure if you're in perimenopause, I would say the best thing to do, you could head to our website, and actually there's a lot of, if you click on the tab that says Learn at the top of our main webpage, you can pull up a lot of articles. There's also some online quizzes that we have embedded in our website as well that can help you to know and identify what symptoms you're experiencing, and if they might be applicable to what's happening as far as perimenopause. But yeah, there is some overlap. And, actually Dr. Green and I were at a conference a few months back in the fall. And, I talked about this in front of a large group of very professional women, in that we see a lot of women all of a sudden starting to exhibit symptoms of ADHD and having attention issues. And we even had that question earlier, Maddie, where the woman was talking about not being able to function as well at work. So a lot of overlap can occur, but really it could also be related to perimenopause and the loss of estrogen. Our brains absolutely need estrogen to function their best. We need it for all of our neurotransmitters to fire and everything to function its best. And so a lot of women that were falsely diagnosed with ADHD then start hormones, and then suddenly they get a lot better. Doesn't mean you can't have both. They can both exist together, but it's more common, that it might be hormone related.
And we have another question next from Facebook. This one is coming from Tammy. And Tammy says, I've been on the 50-50 cream and the DHEA for almost 4 weeks. My doctor just prescribed the vaginal cream for dryness and pain. She says, is the 50-50 cream supposed to help with those symptoms as well? And is it normal to be put on all 3 products? And then she also says, by the way, I feel amazing and like myself again. Thank you as well.
Oh, well, that's good. It's nice to hear that. Yeah. But yeah, your systemic HRT typically will help to a certain degree for some women to help with those vaginal symptoms, but it takes longer. Whereas if you're really suffering from dryness and those genitourinary symptoms of menopause, sometimes giving you the vaginal estrogen will give you more immediate relief, and it works a little faster because we're giving you estrogen directly to the source. So some women that are really suffering with those symptoms and it's really affecting, intimacy or just day-to-day life, they might want to feel better faster. And so sometimes adding the vaginal estrogen in helps as well.
Yeah, I found, the systemic does help, but it doesn't help as much as the vaginal. So if those are really significant symptoms, I've had women on systemic treatment for a long period of time, and it's just not quite enough. And then you add the vaginal estrogen cream, and it's like, oh, I can enjoy intimacy again. It's, and it's a big deal for people. So that is something that can be very helpful. The other thing is that the vaginal estrogen cream does not really absorb into the circulation to any significant extent. So it's safe to use both. It's not going to make your estrogen levels too high. That's something that we often get asked. So it's a very common to use all 3 products, and they actually can work really well in concert together.
And our next question comes from Carly. And Carly says, I am a year and a half into menopause, and I haven't yet tried HRT, but she says I'm definitely interested. She says, I'm trying to remedy body aches and pains, exhaustions, brain fog. She says, I don't get hot flashes much, which is what I've heard HRT says it helps with most. Will it also help me with these other items that I'm struggling with?
Yes, it definitely should. A lot of women will have non-classic symptoms. Especially joint pains, body aches, that's something very, very common, and that typically gets better with the addition of estrogen.
Yeah, it's funny. Sometimes people come in and they just tell you about their hot flashes, and you give them HRT, and then they come back and message us, "Oh my gosh, this joint pain I had is gone." You know, it's like you didn't even consider that was possibly from the menopause transition. So that's always exciting when that happens.
Yes, definitely.
And we have a question next from Martha. And Martha is wondering, is high cholesterol a symptom of perimenopause?
Not so much of perimenopause. I mean, I would say that, having issues with your cholesterol is more of a function of aging. And also, a component of our, can be related to our diet, but can be related to genetics for a lot of people as well. I mean, you could have a pristine, highly nutritious diet where you eat every color of the rainbow. You could work out every day like a fiend and still have crazy high cholesterol. And a lot of that is genetic. And so, it's not typically something related to, menopause itself or perimenopause itself. But
there was that great Lipitor ad that showed like these people in amazing shape, and then it showed you their cholesterol numbers.
Yes.
I remember that ad. That was a great ad. But yeah, a lot of it is genetic. But HRT can help increase HDL, which is what we kind of consider the good cholesterol, and decrease LDL, the bad cholesterol. So it can help your lipid profile, but usually not as sort of your primary treatment for that.
Okay. And we have another question from Martha, and Martha is also wondering, can one overdose on any of these products?
Well, you certainly can get too high of a dose, of estrogen specifically. And typically what we notice is that side effects, might be more persistent, or women might, notice some specific symptoms. Specifically for when you start estrogen, a lot of women will notice breast tenderness. But typically when you're first starting this treatment, it's one of those temporary things that goes away with time. Whereas if your dose was too high, it might be persistent. And also with the DHEA, sometimes, if it's a little too much for your system, you might have issues with like oily skin, oily scalp, persistent acne. And again, this can happen for some women that start the medication, that it goes away on its own. But if it's persisting longer than that acclimation period, then it might be that might be too much for you.
And we have a question next from Jody. And Jody says, I am turning 65 next month, and I went into menopause at age 50. She says, I experienced every symptom for almost 7 years. At age 57, I started an intense strength training program, and I lost 32 pounds on it. She says, however, I feel like I'm getting that thick belly weight again. She says, would your product help with weight?
If you're thinking about starting HRT solely for weight loss, it's not the best treatment out there for that. We have much better treatments out there and available now. And especially if you've gone this entire time without any kind of hormone replacement therapy, and it's been a significant time period since you completed menopause, it might be more dangerous for you to start HRT now after the age of 60 compared to someone who's younger, maybe a year or two out. So there's other medications out there, which we weren't going to get into in the scope of tonight's webinar. We would be talking for hours. But there are some great medications out there available now that are really helping a lot of people with weight loss. And mainly they're the GLP-1 medications. But yeah, so you can talk to your doctor about that. And there's other options out there, but I wouldn't start hormone replacement therapy solely for that.
Absolutely. And our next question is from Sydney. And Sydney says, I'm 63 and I have been off HRT for 6 years now. She says, I have frequent hot flashes throughout the day I have night sweats most nights, dry skin, constipation. I can't sleep, dry eyes, muscle loss, loose skin, hair loss, and more joint pain. She says, I'm tired of it, but can I start on HRT after being off this long? Are there any other options besides cream? Where do I start?
So unfortunately, you're not a candidate to start with us. We don't start patients on new HRT regimens after the age of 60 on our platform. That doesn't mean you might not be a candidate, but it means you need to have more closer observation and someone to monitor you. So seeing an in-person provider who could prescribe for you would be better. And yeah, there are options out there, and you are still within the scope that you could start HRT, but you would need to see an in-person doctor. It's not something we can help you with here, unfortunately.
One of the, like, my main 100% thing, safety. And, we do, I think, a really good job within our system. But this type of telehealth does have its limitations. I can't do a physical exam, I can't do other things. And I can't really sit down and have a long conversation with you. I can't easily get records from other doctors. We don't share an EMR, that kind of thing. So we really work hard at providing excellent care in an absolute safest way as possible. But these are medicines that have, potential downsides as well, and we want to make sure they're done safely. So we always feel bad telling someone, gee, you might be a candidate for somebody locally, but it's not something that we can take care of. And I don't know about you, Kat, I always feel a little guilty, but I know I'm doing the right thing because I don't want to hurt anybody. And that's the big thing. And we really want to be careful and do it well. We want to do what we're doing really well. We take your safety and your health seriously, and that's more important than anything else.
Our next question comes from Rebecca, and it's exciting because I can answer this question. I love when there's a question for me to answer as well. Rebecca's just wondering, is this recorded? Rebecca, yes, these are recorded. You can find these on YouTube. We'll upload them on our Winona account. Also, another great resource to check out is the Menopause Hour, which also has Dr. Green and Dr. Brown on it, chatting about all these questions as well. So yes, don't worry, you can find all the recordings there as well. But back into the bigger doctor questions that I know everyone's here for. Tabitha says, she says, how long can I be on HRT? She says, I'm 42 and I'm in perimenopause.
Well, so really there's not a time limit. Like I mentioned earlier in the webinar, that we used to recommend the shortest duration of time and the lowest dose. It's not so much the case anymore. You can take HRT for as long as you feel you need it. Some women decide, after a period of time that they want to try to go off of it and see how they do. And that's totally fine. But a lot of us that are on HRT and are seeing the benefits of it don't ever want to stop, me included. So, that's something that, you can have a conversation about, but there's not a time limit for how long you can be on it.
It's interesting. My perspective, being in this field, it seems the OBGYNs are particularly the ones that say, you can pry this medicine from my cold dead hands, I'm not giving it up.
Yes.
So it's really the experts that are like, I'm going to be on this forever, which is, I think, telling. So it is safe to be on as long as it's helping you.
And our next question comes from Melissa. And Melissa is just asking, can you please just talk more about what DHEA is and what it does?
Yeah, DHEA is a precursor hormone that your body creates naturally on its own. But what happens is that when your body metabolizes the DHEA, it breaks it down into the levels of estrogen and testosterone. So testosterone is a controlled substance, and it's also, we have to be very careful when we prescribe that because it has a very narrow therapeutic index, meaning that if you give too much, it can cause a lot of side effects. And so giving DHEA is a way for us to gently boost your testosterone levels without the risk of giving you testosterone directly. And with telemedicine, we have some limitations in prescribing, so that's why we want to use the DHEA instead of prescribing testosterone.
Well, yeah, one more thing about DHEA. If you go online and you start looking, you're going to see a lot of scary stuff about it. The reason is that DHEA, it works. And if you take massive doses of DHEA, you have the potential to really drive your testosterone up again to sort of those dangerous levels like we've talked about. I can tell you, most of the gym bros that are doing all the heavy duty testosterone, they're also on giant doses of DHEA, like 200, 400 milligrams a day or more. And the problem with DHEA is that it's a supplement, which means you can order it, go to the health food store, and just without a doctor's help, just start taking it. And people have gotten themselves into trouble really taking massive doses without realizing what they were doing and causing problems. And so because of that, and because it's so readily available, there's a lot of warnings out there, and appropriately so, saying, hey, this isn't a toy, you got to be really careful with this stuff. The nice thing about Winona is that you are under a doctor's care. We're very careful about how we prescribe it. We never prescribe over 50 milligrams. And in that, the 25 to 50 milligram dosage range, it's a very, very safe medication. So those scary things you might see on the internet, don't really apply to the way we're providing it for you at Winona.
And our next question comes from Mary. And Mary says, I recently had my estrogen dose increased. And for the last 4 weeks, I've started experiencing some burning in a burning sensation in my feet and some pins and needles in my calves. She says, can this be related to the increased dose, or is it something else?
I've not had that complaint from patients. I don't know if you have, Mike.
No, I don't think, it sounds coincidental if it happened right when the dose increased. And if it is from that, I would expect it to level off after a month, 4 to 6 weeks. But it's kind of an interesting symptom I haven't really encountered. Estrogen, everybody's different. And every now and then you get somebody who has these just really unusual symptoms or side effects or responses. So I'm not going to say it's not possible, but it certainly isn't common, not something that I've really encountered.
And we have a question next from Rebecca. And Rebecca says, I noticed that my sleep and joint pain improved within a couple weeks of using the cream. She says, I was really excited. But she says, but lately I feel like I'm backpedaling a little bit and some of that pain is coming back. I've also noticed an increase in anxiety. Is it normal for symptoms to return? What can I do about this?
And certainly as time goes on, your body can kind of get used to the medication, but also your body's own natural hormone production might be changing as well. And so it could be that you need a change in your dosage to maintain your symptom relief. So I would typically recommend that you message your doctor and let them know what you're experiencing. Now, granted, if you've only been experiencing an uptick in symptoms for a week and maybe you were sick recently or you had increased stressors at work or at home, they could also affect your symptoms, and you can have a flare of symptoms related to a life event like that. And so if it's only been a short duration, we don't want to go changing your dose too quickly. But if it's a pattern where it's been happening for quite a while, it's more likely that you need a change in your dose.
The other thing I've noticed, so it depends on how long you've been on it, is that for a lot of patients, they tell me that the first week or two, they feel marvelous, and then that kind of goes away. And then it takes a while sometimes to slowly come back. And I think what happens is for some people, that body is so hormone starved that they get this hormone and it's and their body's hooray. And then it sort of gets used to it. And then it takes a while to gradually get those symptoms back under control. That's kind of the way I kind of think about it. It's pretty simplistic, obviously. So if it's been, say, only 4 to 6 weeks that you've been on the medicine, I still think there's a chance that you're going to get back to where you were originally. If it's been a long time, then you probably do need to have a dose increase.
And our next question comes from Melissa. And Melissa says, my gynecologist gave me progesterone. She says 200 milligrams, and I had horrible heavy bleeding that lasted for 3.5 weeks, horrible cramps, etc. She says, I stopped that and the bleeding stopped within 24 hours. She said, my doctor cannot figure it out, so he took me off the hormones and put me on birth control. She says, is it common for progesterone to cause these issues? I'm nervous to go back on it due to this.
Well, if you were taking progesterone only, it certainly can cause more of a risk of irregular bleeding for a lot of patients. Really, for us as women, we need a combination of both estrogen and progesterone, especially when we have a uterus. So giving progesterone only, especially, doing that, your body is responding to the progesterone itself. Progesterone, the way I describe it to patients, estrogen makes the lining of the uterus kind of fluff up like a shag carpet. And when we're actively, trying to be fertile and trying to get pregnant, it helps to prepare that inside the uterus for a pregnancy to implant. And then progesterone comes along kind of like a lawnmower and comes and sheds that lining. You think about a little cartoon person going inside the uterus. So it's like the estrogen's growing the grass and then the progesterone's coming with the lawnmower and knocking it out and kicking it out. So when you're only giving the medication that's causing that lining of the uterus to shed, it would be normal to see abnormal bleeding. And we see this with progesterone-only birth control methods a lot. I've seen it throughout my career. We have progesterone-only birth control pills, and we have progesterone-embedded IUDs and implants. But typically, as your body gets acclimated to something on long term, that usually levels off. But that's not uncommon if you're taking progesterone only. But birth control, we should probably talk about birth control a little bit. This is something we see all too often, and a lot of OBGYNs out there are really comfortable prescribing birth control. They use it their entire career to help women prevent pregnancy and control their own fertility. But really, it's not the greatest option to treat these symptoms that we're seeing in perimenopause and menopause. Like I mentioned earlier, birth control pills, the hormones are synthetic, and the whole goal of these hormones is to suppress your body's own natural function, so that you don't ovulate and release an egg and you don't get pregnant. So when you're experiencing symptoms of the loss of estrogen, and then we give you a hormone pill that actually prevents your body from producing its own estrogen further, it's not going to make you feel the best you can. It might help with some symptoms a little bit, because your body is going to use the hormones the best it can, but it's much better for you with the symptoms of perimenopause and menopause to actually get hormones that your body would be making on its own naturally. So hormone replacement therapy or hormone therapy is much better and much more successful in getting you symptom relief than doing birth control. It's also safer too. So hands down, when you compare birth control pills and hormone therapy is so much safer for you.
I know it's like such a ripoff. It's like with birth control pills, you get all this extra risk and not as much benefit. It's like, well, why do that? Would you rather have less risk and more benefit? And you can get that with hormone therapy rather than with birth control pills. Yeah. It really has to do with comfort level of the doctor providing it. Although in all fairness for you, birth control pills, one of the things that they do better is control menstrual cycles.
Normal cycles, yeah.
Yeah. And so it sounds like kind of in frustration because of your bleeding, they went with what they knew was going to control your cycles, which I understand. I don't want to fault your doctor. But as far as treating the symptoms of the menopause transition, it's really not really the best way to do it.
Absolutely. And our next question comes from Alicia on Facebook, and she's wondering, does the HRT typically cause weight gain?
So overall, long-term, it really should not cause significant weight gain for most patients. However, when you first start taking hormone replacement therapy, your body is going to change a little bit. Some women are prone to bloating or water retention, can affect your digestion and your, transit time, of your food. So sometimes you can get a little bit of temporary weight gain in the beginning as your body's acclimating to the medication. But overall, if we have you on the right dose and you're doing well and your symptoms are well controlled, you typically shouldn't see weight gain in the long term. Now, if you're already gaining weight and you're expecting that when you start HRT that you're going to start dropping right away, that's not also one of the early benefits that we see. It's usually, for women to get their hormones optimized and they get the benefit of weight loss and, optimal metabolism from the hormones themselves. It's one of those later benefits that we see. So it's not something that happens overnight.
And for our last question tonight, we have a question from Jen. A lot of Jens in the call tonight. I love it. She's wondering, she says, I'm now on a GLP-1 medication, and I was not when I was originally prescribed the bioidentical HRT cream and the DHEA. She says, I know that the GLP affects many of the body's symptoms or systems and functions. And she says, with this, do I now need to change anything about what I'm doing with my HRT cream and the DHEA?
You might potentially need to as you lose weight. So, for us as women, as we lose weight, our needs for hormones might change. And so if you lose a significant amount of weight, you might need to alter your dosage a little bit. But actually, we're seeing some great data, and Dr. Green knows a little bit more about this because he takes care of patients, in this arena as well. But we're seeing data come out that women who are actually trying to lose weight, the women who are on GLP-1s alone do pretty good and get good weight loss, but they're actually getting better results for perimenopausal and menopausal patients that are on HRT plus a GLP-1. We're actually seeing better sustainable weight loss in that patient population. They're doing better with the combination of the two medications than one alone. So,
there's also, I've seen some menopause symptoms be helped with the GLP-1s alone. So the two together it's really a dynamic. It's a great combination. And so, for women that are going through the menopause transition and are suffering, with weight issues, the two together work great. And so, sometimes people say, "Oh, do I have to stop my HRT now?" No, absolutely not. Like, this is a great combination. So, it should work well for you. The fat tissues are hormone producing. And so as you lose weight, you may end up finding that your hormone needs to change. That can be adjusted. And again, we listen to your body. Your body will tell us what it needs. And then we can listen and act accordingly and get you feeling your best. But it's a really nice combination.
Well, thank you so much, Dr. Green and Dr. Brown, for being here tonight and answering a lot of our questions. I think these are some great insights into so many different questions that women have. And for anyone who is currently tuned in and listening, if you didn't get your question answered tonight, just a reminder that your Winona doctor is available 24/7 in your patient portal. That is a great place to reach out to ask all of these same questions. They will want to answer your questions, want to help. They'll be able to talk through it, just like tonight, over your patient portal, though, of course. And of course, we also will have more live Q&As and doctor dialogues that come up. So these are always available as well. And like I mentioned earlier, these are also on YouTube, or please listen to our Menopause Hour podcast with Dr. Green and Dr. Brown. And that is a great thing to listen to on your way to work, in the car, anywhere, on your run, on a walk. There's a lot of great ways that you can listen to that. But thank you again for being here tonight and just tuning in. It's a big step also in your health journey just to take the time to ask these questions. So we love seeing that as well. And again, Dr. Green, Dr. Kat, thank you so much for answering our questions and also taking time out of your busy schedules. And I hope everyone has a really great night.
You too.
Yeah, thank you.
Bye.
Thanks for coming. Bye.